41 na. Dami na.
41 na. Hello, good evening, everyone. Dr. Mingitas with us already, and Dr. Jean Solante there. Is Father Ryu here?
I don't know.
We all learned how to use Zoom, no?
Yeah, I know.
This lockdown.
We cannot have even musical productions, no? Because of the lockdown. We've learned how to do that now.
Yeah, I enjoyed that. What you did with
Christmas
ministry. That was
beautiful. Oh, that's different. Yeah, that's means for Christmas we made a musical Christmas card. I didn't, and for Valentine's I made another one for my med school reunion. They said they wanted a Valentine's musical video, so I made one. I'll send it to you.
Sige.
Yeah. Okay.
You need some ideas.
Yeah.
Although there.
Yeah. Oh, 51 na. 51. Just let me know. Anyway, you'll start. We'll just take a cue from you, Rose. No?
All right. Sige, what time is it? Wala pa namang 8 o'clock.
Yeah, it's still early. It's still early. I'll take a break before I'll just leave muna. I'll put off my camera muna. Okay.
Dr. Jean and Dr. Mingita, some people are still entering. Would it be all right for us to wait another 10 minutes?
Yeah, okay lang. Okay
About
lang,
8, if that's all right? Okay, yeah.
Let's allow everyone to come in as much as possible.
Okay.
Has Marlon joined us na? Not yet.
Yes, we're live streaming now on Facebook and YouTube.
Okay.
I saw Mimi Barrera. Is that my tita Mimi Barrera from Canada? I'm wondering. I saw Mimi Barrera join. Let's see.
Marie, are they all muted now or
Yes.
they can sit mute?
No, everyone's muted. They're
Oh.
not allowed to unmute
If
until
you
the
have to,
end of
yeah.
the talk.
If they need to say something really very badly, they can type it down
In
in
the
the chat box. Yes.
Oh.
Is there a raise? Yes, there's. I don't see raise your hand thing here. No?
Yes,
Wala.
there's a raise hand button also.
Okay. I don't see it kasi. Anyway, reactions.
Okay, raise hand. Andre.
Anyway, if I don't see it, then you just help me na lang, Rose. Call them. I can see the questions, but I cannot see the raise hand in my screen, so I don't know why. Anyway, it's okay. Is that thing. Mike Gomez is here. Hi, Mike. I see you.
Hi, Mike. Hello, everyone.
Yeah.
Marisa del Rosario. Hi.
Hi, Marisa. '91 na tayo, and there are people in the waiting room.
Are there people pa in the waiting room?
I saw two kanina. I don't know.
Ah.
I just saw on top. Two people entered the waiting room. 93 now inside.
Yeah, 5 more minutes.
Okay.
Father Ryu, are you here? Not yet.
Yeah. Father's in already.
He's
Who's
in.
here?
Yeah.
Father
Hi,
Rio's here?
Ryu. Evening. There's a question here, Dr. Mingita. Are you
Yes.
eye foundation
I'm still the president of the iBank Foundation.
Okay.
Actually, we're located in PGH, no, in Centro Ophthalmologico Jose Rizal. And we have to go on, there's as you know, maraming positives sa PGH now, eh. No?
Yeah.
We've had to stop seeing walk-in patients, only urgent again and emergent. No? Parang we're back to where we were last
Oh,
year.
oh my God.
Sort of. So parang,
Yeah, I feel
the-
so sorry for all the doctors, working
yeah.
so hard, and then we're back to day one again,
And many doctors, kasi, like the young ones and the residents, sometimes when they eat together, they forget. It's usually the eating together. So what it's true for doctors as well as it is for people, other people. It's the eating together, the socializing, the eating. Sometimes you forget.
And that's very Filipino, di ba? When you eat,
Yes,
you can't exactly.
yes, correct. Yes. I remember that well. Through her, I caused the donation of my best friend and my first cousin after. Thank you very much, Noel Malaya. No? You donated the corneas of
Oh,
my best friend in 2004 and my first cousin afterwards. Thank you so much.
oh, yeah, it's a big help.
We should have another session just about
That's
iBanking, cornea donation. Different session.
that. Ano, do I need a card for that if I want to donate?
It's better to have a card, or you have a card. You can do it online. You can have an e-pledge in the iBank website, and or your relatives can do it for you, even if you don't have a card if they want to. But it's always nice that you have, so that it's not difficult for your
Yeah.
relatives to make the decision.
But is it a different card for each organ?
Um,
Pwedeng yung the whole
yes, there's a unified. Even the driver's license, you can put it there.
Oh,
And
okay.
and then all the different, like NKTI Project, Hope Foundation, iBank, we're all networked together. So if there's a multiple organ donor, they call us for the corneas or for the eyes. We call them for the kidneys. So it's like a network, already.
We're
So,
more than
Yeah,
100 now.
Mike showing his card.
okay. Oh
Where
yeah,
we're
Mike. See, Mike is a donor there. He's
ah,
a donor. See.
call you, Mike, and ask you how you got that.
Okay. Sige. Ibang seminar yan. Okay.
Ibang
Ibang webinar. Ibang session yan. Tell me when you're ready, ah. But how many are we na ba? Madami na ba?
We're
104.
104.
Read
Yes.
already.
Yeah,
Over-
maybe we can
I
start
think we can
na.
start, yeah.
We can start 8:10. Yeah, it's
It's
8:10.
8:10. It's
Okay,
8:10.
it's 8:10.
All right. Sige. So we'll start. Marie, would you like
Okay.
to?
Okay, let's start with a prayer. Let us put ourselves in the holy presence of God. In the name of the Father, the Son, and the Holy Spirit. Amen.
Amen.
We fly to your protection, O Holy Mother of God. In the present tragic situation, where the whole world is prey to suffering and anxiety, we fly to you, Mother of God and our Mother, and seek refuge under your protection. Virgin Mary, turn your merciful eyes towards us amid this coronavirus pandemic. Comfort those who are distraught and mourn their loved ones who have died, and at times are buried in a way that grieves them deeply. Be close to those who are concerned for their loved ones who are sick and who, in order to prevent the spread of the disease, cannot be close to them. Fill with hope those who are troubled by the uncertainty of the future and the consequences for the economy and employment. Mother of God and our Mother, pray for us to God, the Father of mercies, that this great suffering may end, and that hope and peace may dawn anew. Plead with your divine Son, as you did at Cana, so that the families of the sick and the victims be comforted, and their hearts be opened to confidence and trust. Protect those doctors, nurses, health workers, and volunteers who are on the front line of this emergency and are risking their lives to save others. Support their heroic effort and grant them strength, generosity, and continued health. Be close to those who assist the sick night and day, and to priests who, in their pastoral concern and fidelity to the gospel, are trying to help and support everyone. Blessed Virgin, illumine the minds of men and women engaged in scientific research, that they may find effective solutions to overcome this virus. Support national leaders that with wisdom, solicitude, and generosity, they may come to the aid of those lacking the basic necessities of life and may devise social and economic solutions inspired by farsightedness and solidarity. Mary Most Holy, stir our consciences so that the enormous funds invested in developing and stockpiling arms will instead be spent on promoting effective research on how to prevent similar tragedies from occurring in the future. Beloved Mother, help us realize that we are all members of one great family and to recognize the bond that unites us, so that in the spirit of fraternity and solidarity, we can help to alleviate countless situations of poverty and need. Make us strong in faith, persevering in service, constant in prayer. Mary, consolation of the afflicted, embrace all your children in distress, and pray that God will outstretch his all powerful hand and free us from this terrible pandemic, so that life can serenely resume its normal course. To you who shine on our journey as a sign of salvation and hope, do we entrust ourselves. O clement, O loving, O sweet Virgin Mary. Amen.
Amen.
In the name of the Father, and of the Son, and
In
of
the
the
name of
Holy Spirit.
the Holy Spirit.
Amen.
Amen. Thank you, Marie. And thank you also to all of you, all of the viewers, for being here tonight. Good evening. Thank you so much for joining us for the third episode of our mini streams. These are talks on varied topics organized and brought to you by the different ministries of Santuario de San Antonio Parish. Tonight, we are fortunate to be with two distinguished doctors in their fields of expertise. Our moderator will be Dr. Maria Dominga Padilla, fondly called Doctora Minguita. Most of us are familiar with her as she is an active parishioner and is always so gracious and generous in sharing her beautiful voice during as well as her medical expertise and opinion each time we are in need of advice or clarification, even up to 11 o'clock in the evening. My Doctora Minguita,
Thank
especially
you.
regarding our COVID-19 protocols and responses. Doctora Minguita is a clinical associate professor at the Philippine General Hospital of the University of the Philippines College of Medicine. She is an active consultant at the St. Luke's Medical Center Global City and the founder and president of the iBank Foundation of the Philippines. So thank you so much, Dr. Minguita,
My
for
pleasure.
guiding um, and for presiding over this important and relevant discussion. So tonight, we are blessed with the presence of Dr. Ronchine Solante, our expert medical keynote speaker. And, with the rising number of COVID-19 infections, the presence of COVID variants in our country, various vaccines that we can choose from, alternative cures, and questions on their safety and efficacy, we are really very eager to listen to your talk, Dr. Solante, as this will help us in our discernment as to what would be best for ourselves and our loved ones. So we really would like to thank you, both of you, for joining us tonight. Dr. Ronjin Solante is the head of San Lazaro Hospital's Adult Infectious Diseases and Tropical Medicine Department. He is one of our country's top experts on infectious diseases and is the current chair of the Infection Prevention and Control of Manila Medical 3. Dr. Solante is also a member of the Vaccine Expert Panel of the Department of Science and Technology. And together with Dr. Minguita, they are a part of a group that tries to build vaccine confidence. So without delay, allow me to turn this over to my niece, Dr. Minguita Padilla.
Your
Makes me
niece is
sound
so
so old, so
what?
old. We are all ears.
Okay, thank you, Rose. Yeah, I'm actually her niece, but she's a little, just a few months younger than me. So that's how big our family is. No? Okay, thank you very much for inviting me to this event. No, it is my distinct pleasure to moderate a session with my good friend who became my good friend because of the COVID pandemic. No, si Jean Solante, who I hold in very high esteem. So I will not take much time anymore. I just want to lay down some house rules. Okay, you can ask questions via the chat box. You're all muted. So if you think of something you need to ask, please type it down and we will take them up after the talk of Dr. Jean Solante. Okay. Now, if you don't know how to do the typing and you want to raise your hand, you can also raise your hand after the talk. But the questions can be typed during. Okay, without further ado, I'm going to call on Dr. Jean Solante. Take it away, Jean.
Yeah, thank you, Doctora. Thank you, Ma'am.
Ma'am,
I
wag na.
always have high respect ni Doctora. No? And nakilala rin ako dahil kay Ma'am eh.
Ako nagpakilala yun sa media.
Oo.
Okay.
So anyway, I'll have to share my slides muna.
Okay.
Okay. Kita naman, Ma'am, no?
Kita. Oh, it's fine. You're good.
Okay. So I've discussed this with Ma'am regarding the topic for this evening, and somehow we conceptualize this that there will be four important questions that we'll have to address or issues to address. No, why vaccine is important to control the pandemic, and how are vaccines selected. So we'll go through several of these uh, evaluation criteria by the vaccine expert panel. And of course, the main bulk of the discussion will be the different safety and efficacy data of this COVID-19 vaccines. And the last part will be about the how the government will deploy these vaccines and what are the prioritization allocations among the population that will receive the vaccine. So I'll start first with this particular slide, and quite very important for me in the sense that vaccine is not only very important in terms of controlling an epidemic, but we've seen a lot of these infectious diseases for several years now that vaccine has been available, and it is also a vaccine that was able to control most of these infectious diseases. So to just name a few, like polio, pertussis, measles, and you have also chickenpox, hepatitis A, mumps, and rubella. So the bigger circle here are the numbers of the cases during the time that vaccines were not available, and this red or dark yellow circle where vaccine was cascaded and rolled out, and you'll see the impact of the vaccine where most of the cases were significantly controlled. Okay, but I think you've heard of 4 to 5 years, 3 years ago, when our vaccine hesitancy started to dwindle down, and we have the occurrence of some of these supposedly controlled infections like measles, and in fact, we also have polio. There was a resurgence of polio and outbreak of some of these important infectious diseases because of the very low vaccination coverage among the children, which were the target population of these vaccines, being highly vulnerable. So, in short, there's always a proof that vaccine is very important in terms of controlling these infectious diseases. Now, I think most of you are familiar with this Swiss cheese respiratory virus pandemic defense now. And I think this is what we've been doing now from the time that we had the pandemic. We implement physical distance and then ventilation for those patients or for the room for us to decrease the virus intensity in a particular room. That's why in closed area, we always implement a good ventilation. And then we also implement the use of face masks even in the public, and then hand hygiene, surface cleaning. And then for those who are positive, very important also to isolate them so that to stop the transmission, and those who are the direct contact of those positive are being brought to what we call quarantine facilities. Okay, but one of the last part here is the vaccine, and if you look at there are holes in each of these trees because there are no perfect interventions that will really prevent this pandemic. Okay, but there is this small holes that can also be uh, addressed in terms of why we need most of these interventions, and the last one is your vaccines. So this is how when a vaccine is approved by the Philippine or the Food and Drug Administration of the Philippines, before it goes to the FDA, the first touch of the vaccine evaluation will go to the vaccine expert panel for technical evaluation. Whether the vaccine company applies for a clinical trial or applies for an EUA, then we in the panel we set this criteria. So first is the track record of a company in who develops that particular vaccine. So if the company is known for a vaccine development for several years now, we give a perfect 10 score of 10. Okay, so you'll notice that some of these companies are not into vaccine manufacturing. Like AstraZeneca is not a vaccine company, so that's why they partnered with Oxford University to come up with a partnership so that they can have a very good science in terms of their vaccine. Sinovac is a vaccine manufacturer only in China, so they don't have a good track record in the past in terms of producing vaccines outside of China. Although they might have some of their products also being brought to like Hong Kong and Singapore, but again, they're not major players in terms of vaccine manufacturing company. Then Pfizer is also not a vaccine company. Their vaccine arm is Wyeth. That's why they have their first vaccine before was Prevnar. They bought Wyeth, and that's the reason why when Pfizer partnered with BioNTech, a European firm, then that also made them a major company now in terms of vaccine production. Now, the second of this is your technology platform. So we always look at technology in terms of this, what type of vaccines are being produced, and you notice that some of the technologies that are being used here, or most of the technologies are already are already in place because they have been used for previous infectious diseases. No, and I'll give an example later on what are these technology platforms. So it's 10%. Then we also review the phase 1 and 2 clinical trials. I'll expound on this later on. That's quite big, though. That's 20% because that determines that if the phase 1, phase 2 data of that particular vaccine is very good, then that will now proceed to the phase 3 clinical trial. So this is number 5, which in this manner, the weight is the highest, no, 30%. Now, immunogenicity is the ability of the vaccine to produce an antibody. So most phase 1, 2 trials usually have a very good data on immunogenicity before they can be approved for phase 3 trials. So this alone, the clinical development is already 50%. And then you have vaccine implementation, meaning if a single dose is available, we always prefer a single dose over that of 2 doses because if you have a single dose, your body produces an antibody the soonest possible time, while if you need 2 doses, an interval of like 4 weeks or 3 weeks, then somehow you need to complete the 2 doses for you to be immune against the infection. So this is how the phases of clinical development. It usually starts with the preclinical, wherein the vaccine will be tested among animals. Okay, and then if this is successful, then the vaccine will be tested in 10 to 100 individuals. So this is the phase 1. The purpose of the phase 1 is really looking at how safe the vaccine is, and at the same time, what are the local and systemic reactions that are common among that particular vaccine. And then in the phase 2, if this will be successful, if the vaccine is safe, then the clinical trial will now proceed to phase 2, wherein 100 to 1,000 individuals will be tested with the vaccine. And here we will find what is the dose that will optimize our body to produce an antibody. And at the same time, we also put here the population that are the target of the vaccine, wherein there is higher mortality or higher risk of also of getting COVID. And of course, safety assessment is still part of phase 2. And then after that, phase 3 will be there, wherein there will be around 20 to 40,000 participants will be given the vaccine, and compare it with those not given the vaccine. And here, the most important objective now is how effective the vaccine will protect those who had been vaccinated, and compared those who are not vaccinated by looking at the presence or absence of a COVID infection. Okay, so this is how the different phases of vaccine. Also, because there are a lot of questions that since the usual time frame that a vaccine development will take around 10 to 15 years, and most of the vaccines now are being developed in less than a year, or even 8 months or 9 months. So there are some hints of it might not be a good vaccine because it was done only in a small limited number of time that it is being developed. No, so yeah, I agree with that. No, but again, it still underwent this important phases of clinical development. So if you look at the different platforms here, you have the virus inactivated. An example of this is your Sinovac and Sinopharm. Okay, and then you have the viral vector. An example of which is your AstraZeneca. You have your J&J, and then you also have here the other vaccine, the mRNA, which is the current leader now in terms of higher efficacy, and at the same time being used in developed countries, no, the Pfizer and the Moderna vaccine. Okay, so these are the total number of vaccines that are in development, either in phase 1, phase 2, and phase 3. So meaning we have around like more than 200 vaccines in different phases of clinical development. So hopefully all of these vaccines will be available 2 to 3 years from now, so that everyone in globally will be given the vaccine. But again, we are really trying to make the vaccine available for this year, because we would like to end the pandemic as soon as these vaccines are available. So these are some of the mechanism of how the vaccines work. No? So in short, they all target the spike protein. So they produce an antibody against the spike protein. So why spike protein? Because spike protein is the part of the virus that binds to our host cell. Okay, so that's very important, because when the vaccine produces an antibody, it will block that binding site of the host cell against that particular virus. So there will no more additional virus that will go inside the cell. So that's quite a crucial part of the viral replication, because when you block that particular area, then you also decrease the risk of developing the symptoms once you have the antibody. Okay, so the next question here is how safe and effective vaccines are. You know? Okay, so gaano ba sila ka-safe? So before we go to the safety data, I will discuss the efficacy data. So probably you've heard that most of us will mention efficacy or vaccine efficacy is 50% or 95% for Pfizer, 94% for Moderna. But if you look at most of these clinical trials, there are other aspects of efficacy that is also being evaluated. Aside from the efficacy of the vaccine to prevent symptomatic COVID, there is also a part of the trial that they will also look into how good the vaccine can prevent an individual from developing moderate to severe COVID-19. Then the third a parameter of vaccine efficacy is that how good the vaccine can also prevent COVID, especially the more vulnerable population. And these are the 60 years old and above. And then the fourth of this is that how good the vaccine is if given, whether it's an 18-year-old, 50-year-old, or a 70-year-old across all ages, ethnicity and race, whether it's Asian, American, Caucasian, will the vaccine work in any of this ethnicity or race, and including underlying conditions. So meaning that vaccine should work regardless of what comorbidities you have, whether you have hypertension, diabetes, or patients who are immunocompromised. If that vaccine works all across these factors, then that's a very good vaccine. And we will see which vaccines does have all of these parameters. Okay, so we'll start first with the three vaccines that were approved in the US, given an EUA. This is your Pfizer and Moderna, and then AstraZeneca was also the second vaccine aside from Pfizer that was approved in Europe. Okay, so for the study population, except Pfizer, Moderna, and AstraZeneca, the indication here is it should be given to 18 years old and above. Okay, Pfizer was 16 years old and above. Now, for the first parameter, how good the vaccine can prevent the presence or prevent symptomatic COVID. So you have Pfizer here, 95%, Moderna, 94.1%, and then for AstraZeneca, the overall efficacy is 70.4%. For those elderly that are 65 years and above, both Pfizer and Moderna are way above in terms of very effective. 94.7% for more than 65 years old. For Moderna, it's 86.4%. AstraZeneca didn't have any data on the 60 years old and above because during the time that they released this interim data, they're still collecting the data for 60 years old and above. But since their immunogenicity study was very good, that's why most European countries, except for a few like Germany, did not approve the use of AstraZeneca for 60 years old and above. How about the ability of these vaccines to prevent severe COVID? So all of them, no, all of the three, 100%, Moderna, 100%, AstraZeneca, 100% prevent hospitalization. Now, this is where most of the vaccine may not be, the data may not be available. For efficacy across age, sex, race, ethnicity, and underlying medical conditions, Pfizer said they are 92% effective. Moderna said they are 95.2% effective. AstraZeneca said that yes, we have also a data for that, but we cannot still collate. But again, it is effective regardless of sex, race, ethnicity, and underlying comorbidities. Okay, so these are some of the important parameters. Now we go to the other group of the vaccines. Your GAM COVID vac or the Sputnik 5, that is the vaccine being manufactured by Russia. The indication also is 18 years old. The Sinovac is also 18 years old. And then except for the Brazilian trial for the Sinovac, the two trials conducted in Turkey and Indonesia were between 18 to 59 years old. And probably you're aware that it's only in Brazil that they did 60 years old and above. And yet their number of population in the 60 years old were too small. That's why they cannot come up with the recommendation for 60 years old and above for the Sinovac. So here, for prevention of symptomatic COVID, the Sputnik vaccine is 91.6%. For Brazil, Sinovac, it's 50.4%. And then for the Sinovac Turkey data, it's 83.5%. And among these two vaccines, it's only Sputnik 5 has the data in terms of the more than 60 years old, which is 91.8%. But all of these, so the Sputnik 5 and the CoronaVac or the Sinovac vaccine, prevent also moderate to severe COVID, 100% for Sinovac, 83.7% to 100%. So these are some of the important data that these vaccines have. No? And then the Sputnik vaccine also, in terms of vaccine efficacy across age, sex, race, and regardless of medical conditions, it's more than 87%. So it's really a nice vaccine also. Now for the other data here, this is NVX, this is Novavax. No? So Novavax is they conducted the trial in two countries, the UK and South Africa. Okay, so Novavax was the first vaccine to say that they are effective against the UK variant. Why? Because in their trial in the United Kingdom, 50% of those cases that developed COVID after given the vaccine, okay, are having the UK variant. So they claim that they are 89.3% even with the UK variant present in the trial. Okay, But their trial in South Africa was a bit have a lower efficacy rate. It's only like 61.1%, but it still passed the WHO criteria. But in their trial, when they did collect the data for those overall efficacy, they found out that their overall efficacy is only like 49.4%. And this is mainly driven by the fact that 93% of those who had COVID while given the vaccine, 93% have the South African variant. So you'll notice here that with the South African variant, it really affected the efficacy of Novavax now. And then you have the Janssen, the first vaccine that it can be given as a single dose, and the third vaccine that was approved in the USA for an EUA. So this is the only vaccine that the criteria for or the objective of their data was prevention of moderate to severe COVID. So 66% in that vaccine efficacy, and then prevention of severe overall is 85%, and then across age, sex, race, and underlying medical conditions, it's also 85%. Okay, so the question now is the presence of this variant, can it affect the possible reduction of vaccine effectiveness? So just to go through some of these variants, what we call variants of concern, we have here the UK variant, which was first detected in September. Then you have the South African variant detected in October. And then you have the Brazilian variant, which was detected in January. So the advantage of this variant over the old variant is its ability to be highly transmissible. But we're now getting data that it can also possibly reduce the effectiveness of current vaccine. So meaning it may reduce the efficacy, but it's not also zero that the current vaccine will not work against this variant. So I made here a summary on how these vaccines are effective against this new variant. No? So these are data coming from their report and media releases. Okay, so Oxford claimed they are 74.6% active against the UK variant. I think you know the other data that the interim data that they produced when they released the South African trial of their vaccine, wherein it was only effective in like 10 to 30%, but they're still collating the data and it's not final yet. No? Novavax is 89.3% active against the UK variant. And then you have Janssen, 66% active against the South African variant. And then Novavax, 49.3% active against the South African variant. So there's now a possible application of Novavax that they will reformulate their vaccine and add another strain to stimulate or to produce an antibody that it will be effective now with the South African variant. Pfizer and Moderna claim that they are still effective against both the UK and the South African variant, although slightly affected the overall efficacy, especially the South African variant. And Sputnik 5 and Sinovac claim that they are also effective against both UK and South African variants. So all of these are just press releases, and there are no published data yet on this pronouncement of their efficacy against these variants of concern. So I'll proceed now with the safety data. So when you look at safety data, you will always have to look into what are the most common local and systemic adverse events, and if there are also serious adverse events. Okay, so before we'll proceed, I would just like to present this, that most of the vaccines, even before this COVID-19 vaccines, when you have measles, pneumococcal, influenza, hepatitis B, and the rest of the vaccines, these are some of the most common adverse reaction. Okay? So talagang kasama na yan sa mga adverse reaction ng bakuna, no? Nasanay na tayo. So it's not new to us having a patient complaining of pain at injection site, or tenderness at injection site, or sometimes they feel like they have headache, myalgia, fatigue, or a chilly sensation like flu-like symptoms. These are all part of the adverse reaction of a particular vaccine. So I also made a table so that everyone can take a look at what are the common local reactions and systemic reactions in any of these vaccines. So you'll notice that for all of these vaccines, Pfizer, Moderna, and Astra, you're giving 2 doses, no, at different interval of time. Now, what is the most common local reaction? It's always pain at injection site. No? So all of these three. And then there are also some will have redness and swelling at the site of injection. Okay. Some complain also of lymphadenopathies at the site of the axillary area where um, they give the injection. Okay. And then the most common solicited systemic reaction after giving the injection, or patients usually said that they have this feeling of fatigue, headache, muscle pain, chills, joint pain. For Pfizer, more or less the same as that with Moderna. And then, of course, you have experienced now a lot of these healthcare workers are complaining a lot of this fatigue, headache, feverishness, and myalgia, no, with AstraZeneca. But again, if you look at the severity grade, most of these are mild and moderate, and none, in fact, none are in the severe form, except for Pfizer that they also reported severe adverse event. Like there was one who had shoulder injury, right axillary lymphadenopathy. There was also one who developed arrhythmia, one who developed right leg paresthesia. But all of these are self-limited, and all of this vaccine, they did not report death related to the vaccine. Okay, so this is an illustration because the current vaccination program now is focusing on AstraZeneca. No? So you might hear some of these doctors or some of your friends who are frontliners that are complaining of some of these adverse reactions. So this is the standard prime dose, meaning first dose of AstraZeneca. What's the most common solicited local reaction? It's pain and tenderness at the site of the infection. So it's like a pink color here. Most of them are mild, and most of the time it's within 24 to 48 hours, and after that will subside. Okay. You also have here the degree of the pain and tenderness. You'll notice that among the elderly from 56 to 69 and more than 70 years old, more or less you have lesser number of these solicited local reaction compared to those in the younger population. And then the systemic reaction, the most common with the AstraZeneca, you have here fatigue, fever, headache, joint pains, malaise, then you have muscle aches, and then nausea. No? So again, if you compare this systemic reaction, more or less it's less that was seen among those who are 70 years old and above, including that 56 to 69. It's really common among those who are 18 to 55 years old. Okay. How about the Sputnik and the Sinovac? What are the common local and systemic reactions? More or less, it's the same. No, for Sputnik vaccine, it's flu-like illness, including that of injection site reaction, and then headache, asthenia, and 94% are mild. For Sinovac, pain at injection site. I also felt this one, but there was no redness and swelling. But after 24 hours, I also felt some mild headache and myalgia. Okay, so that's again the common solicited systemic reaction for Sinovac. So in these trials, they did not documented any death related with the vaccine. So this is just a total compilation of the different systemic and adverse reaction of all of these 5 vaccines. Now, we just like to emphasize here that when one will be injected, okay, this will also start the stimulation of your immune cell. Okay, that's why pain here is an indication that the vaccine has in contact already with some of the important immune cells. That's why they're producing a local production of your substances that mediates inflammation. That's why you have swelling, pain, and redness. No? And they said that the presence of headache, fever, and fatigue is also a sign that the other inflammatory factors in the blood are already in contact with the antigen, which is the vaccine. So that's a good sign, meaning your immune system has started to be stimulated when you also have these initial symptoms. But it doesn't also mean that the absence of the symptoms, you are not receiving the vaccine, no? Or they said, baka placebo to kasi wala akong lagnat or walang pain at injection site, no? So hindi rin, no? It's just that there are some persons who have a higher inflammatory response when they will be given the vaccine. So what are the contraindications? So we'd like to focus on this one because this is one of the most frequently asked questions. Pag meron ba akong allergy sa mga gamot, sa mga pagkain, sa pets, or environmental, or family history allergy, pwede ba ako makatanggap ng bakuna? No? So here, you may proceed with the vaccination. So among people without a contraindication or a precaution, like allergy to oral medications, history of food, pet, insect, environmental, latex, etc., allergies, family history of allergies, yes, you can. No? But these are also the person that will be observed for 30 minutes after the vaccination, and then for the possibility of anaphylactic or severe allergic reaction. The most important contraindication here is the severe allergic reaction after a previous dose or to a component of the vaccine. And I think the report here is that Moderna and Pfizer had a lot of this severe allergic reaction because of the component of the vaccine, which is the polyethylene glycol, which will make the vaccine stable because it's an mRNA vaccine. No? For it to stimulate the immune cells, you need that polyethylene glycol to make the vaccine stable. But there are people that are allergic to that particular component, and that's why you need to really ask your allergologist if you're allergic to that particular component of the vaccine. So if you had that history, do not vaccinate. So if you're given Pfizer or Moderna first dose and then you develop severe allergic reaction, then you will not be allowed to get the second dose of that vaccine. Okay, so you'll be given other vaccine platform alternative. Okay, then precaution to vaccination among people without a contraindication, a history of any immediate allergic reaction to other vaccines or injectable therapies. No? Sabihin natin, meron akong allergic sa influenza vaccine or sa pneumococcal vaccine. That's not a contraindications, just a precaution. So meaning you can still give the vaccine based on your risk assessment, and then at the same time they have to be observed 30 minutes after being given the vaccine. Now I'll go to the important endpoints of a COVID-19 vaccine. Why are we so hopeful that this will end the pandemic? Okay, so there are different endpoints of a clinical trial, as I've mentioned to you. Okay, the vaccine can prevent the entry of the virus to the individual, so that's why it can prevent infection. If an individual is exposed to an asymptomatic infection, it can also prevent the disease. Then at the same time, if the person is having the vaccine and develop the symptoms, it will just be mild and prevent hospital admission, and at the same time also prevent intensive care unit. And that's very important because when you are receiving that vaccine that will prevent a severe form of your COVID-19, then that will also prevent death. No, so when you prevent death, then that's an important parameter already, because when you look at our hospital facilities now, especially the ICUs, which is always the indicator of healthcare facility burden in terms of COVID-19, is that most of those with severe cases always ends up with a higher rate of mortality, and they're also the one occupying the ICU, which is really costly. So I made here a particular table conceptualizing which among this vaccine will have any of these efficacy on endpoints. So I put this: what are your expectations of a COVID vaccine? Are they present in the current vaccines that are available? Okay. So for example, prevent infection or prevent symptomatic disease, all of this pass that particular criteria. You have Sinovac at 50.4%, AstraZeneca 70%, Novavax 89.3, and then Pfizer, Moderna, and Sputnik from 90 to 95. Okay. What about the ability of the vaccine that if you develop the infection, it is not severe? That's why you prevent that particular individual from going into the hospital. Okay. So Sinovac has 83 to 100% efficacy rate in terms of preventing moderate to severe. AstraZeneca, Pfizer, Moderna, Sputnik has 100%, and then the J&J 72 to 100%. So maganda rin ang efficacy nila in terms of prevention of hospitalization. What about prevention of intensive care unit admission? So meaning these are the ability of the vaccine to prevent severe COVID. No? So lahat sila 100%. So meaning this is an important aspect of vaccine na kailangan din nating titingnan. No? Hindi lang yung overall efficacy. So because when you prevent intensive care unit admission, then probably you most likely will prevent death in that particular individual. Now, prevent transmission. Not all of these vaccines are designed to in give us an information of that vaccine if it can prevent transmission. But if you look at how the vaccine can prevent an infection, prevent disease, and prevent hospitalization, these are the objectives of both of the vaccines. And when you prevent a patient being infected, having the disease, or hospitalized, then that's already will affect already also the ability of this vaccine to prevent transmission. So in a way, there are what we call indirect benefit that can also decrease the risk of transmitting the COVID-19 when you will be getting this vaccine. Okay. So the last part of my talk will be on how the government, no, why is there that we are prioritizing a specific group of population to be given the vaccine. Bakit hindi kailangan pwede lahat na lang bibigyan, no? Mainly because one, the current vaccines that are approved is only given an EUA. So when you have an EUA, that is based on the data of the vaccine by which it was able to comply with the efficacy endpoint as mandated by the WHO and the FDA, that if you reach that particular efficacy data or rate, then you can be given or you can give that vaccine to specific population, not yet on mass vaccination. And at the same time, because the allocation is really more on the limited supply of the vaccine, so more or less we have to prioritize specific population to protect, because these are the population that higher risk of getting the infection, which are your workers in the front line health services. That's why they are the priority now, because we want them to be also developing antibody immunity so that they will be taking care of our COVID patients. And then the next group of this priority group will be the all senior citizens now. So meaning after the frontline health services will be given the vaccine, then the next allocation will be for the all senior citizens. And then the phase 3 will be the indigent population. And then the phase 4 will be the uniformed personnel. Then after that, the rest of the population, including the frontline workers and special population, will also be getting their vaccine. So this is the target population of our government, that by 2021, the government will be able to vaccinate 63% of the total population. So I will explain later why we need a 63%. No? So if you look at 63%, that's approximately 70 million Filipinos should be given vaccine this year. And then the remaining 37% will be in 2022, which will be around 42 million. And then 2023, the remaining 2 million or 2% of the population will be given the vaccine. So this is a 3-year phase program of the government so that everyone will be given the vaccine. Okay. So why we need 70 million? This is to achieve herd immunity. Okay. So herd immunity is the immunity that will be afforded to people that were not vaccinated as a result of the majority of the population being given the vaccine and produce an antibody. Okay, so if I'm going to look at the it that way, okay, there are two ways of achieving herd immunity. One is all the individual population will get the infection and you develop immunity. So this is quite difficult, no? Because if you let the natural infection infect all the population, then chances are we also have a higher rate of mortality. The other one is immunization. So this is why we need to target more people to get the vaccine. Okay. So this is how it would work. Okay. If the people, population in the community or in our country will be 70% vaccinated and only the remaining blue ones are susceptible, what will happen if you have an infected COVID-19? Okay, so this infected COVID-19 will not be able to infect already the population because most of the population are already vaccinated. Okay, except for a few that were not vaccinated, they will be protected because the people surrounding them are already vaccinated. So this is what we call the herd immunity. So people that were not getting the vaccine, but since there are more people who got the vaccine, they were able to protect those that did not get the vaccine. So in order to achieve that, we need to vaccinate 60 to 70% of the total population. Okay, so I think this will be my last slide. As I've mentioned, vaccines will be our last recourse in terms of ending this pandemic. We have tried the most investigational drugs, but so far, only a few of these investigational drugs we have found to be really beneficial in terms of preventing mortality. Okay, and again, most of the current drugs are still in the investigational phase of approval. We have done a lot in terms of the minimum health protocol compliance, like wearing the face mask, okay, physical distance, and hand hygiene, and yet we're still in this thick of the pandemic. And this is the reason why that it's the option now that we need to believe that vaccine will end this pandemic. So I made this short way of convincing my co-healthcare workers in the hospitals where I am affiliated, given the fact that when I was giving the talk for COVID vaccine before the rollout, I always remind them that getting vaccinated will give us protection from getting COVID, will give us protection from getting severe COVID and risk our life of our vaccine preventable infection. It will also protect us from getting the new variants of COVID-19. And I also put here, if you get vaccinated, since I love my family, I will be protecting also my loved ones and co-worker. Okay, and because I believe that getting vaccinated is important, because I believe that vaccine is safe and effective and the only intervention to stop the pandemic. Okay, and then I also put here, because I want to go back to a normal life. Okay, and last, this is what Pope Francis emphasized, that vaccine is one of our moral obligation. With that, thank you very much for your kind attention.
Thank you very much, Jean. Okay, I'll put my video on now. Okay, thank you very much for that very informative and thorough lecture, Jean. And now I'm going to start asking some of the questions which gathered during your lecture. I know you tackled already on who can and cannot, because so many people asking about allergies, bronchial asthma. They have allergic rhinitis. I know you already explained this, but can you answer again one more time? If I have allergic rhinitis and I have bronchial asthma, because one of our audience said when she got the flu vaccine, she developed bronchial asthma. So it kind of scares her to get the vaccine. So can you answer these questions?
Yeah. So I think
allergies?
the recommendation on those people who had allergic reaction, as I've mentioned, is that they are not a contraindication to receiving the vaccines. Just that they have to be monitored after receiving the vaccine for possibility of a severe allergic reaction, which is also very rare among this population.
Just FYI, I have allergies. I have allergic rhinitis. I'm allergic to pollen. I'm allergic to mold. I'm allergic to certain seafood which is not fresh. But I got my Sinovac and I had no adverse reaction. The only thing I felt was a little sleepy and a very mild headache that afternoon. And maybe they say it's like fatigue. Meanwhile, I felt was drowsiness. So despite, I was actually also concerned about my allergies, but I did not get any adverse reaction. So yes, you can. But if you have severe reactions to vaccines in the past, any allergic reactions, then you have to tell them, you have to be monitored longer. Because correct me if I'm wrong, Jean, almost 100% of the reactions or allergic reactions occur within the first 30 minutes of the vaccine.
Yes, correct.
So that's why you're monitored. Okay. So the monitoring of the person will depend on your history. So we have different stickers: green, 15 minutes monitoring, mga ganyan, may color coding yan. So you will be monitored. Okay. And from the Philippine experience, very few had, I can tell you in PGH, out of 1,775 vaccinated healthcare workers, only 2 got anaphylactic reactions, and they were just given epinephrine and they're fine. Nobody died. Nobody was put in the ICU, at least in PGH. No? So there. Okay. Can we go? Wait, there's a question. My son, who is an EpiPen user, was not allowed to take a vaccine in Singapore. What, any vaccine? Okay, so is it possible that maybe he is very allergic to certain components of the vaccine? No? I don't know. What would you make? Di ba you said there are absolute contraindications to vaccines, but these are very few, Jean.
Yeah. I have one co-worker, doctor, who is also on EpiPen. Every time that he had that allergic reaction for food and seafood, and he's always bringing that one. Two of these, no? So when I cleared them for the vaccine, I was there when they were given the vaccine, and luckily, wala namang nangyayari.
Yeah. So I don't know, maybe it's the call of their doctor.
Yeah.
I'm not sure. No? If you're allergic to corrupt senior health officials, that's different. That's different. That's a different allergy. Now, another question. If you had 2 doses already, you completed 2 doses of a certain vaccine, no? And then you want to get another vaccine because you say another vaccine might be more effective with a variant, no? Is that possible? Kunyari, you completed your 1 vaccine, pwede ka ba bang another vaccine after that?
This is the complexity of vaccines, no? Kasi hindi kagaya ng tableta na pwede kang mag-mix ng mga tableta, no? For you to really get that information, vaccines can be mixed. You have to make a study on that, no? Because there's a possibility that the antibody there will be antibodies. So in short, there will be possible antibody interference from one vaccine to the other. Okay. So yung mga administration with another vaccine, pinag-aralan yan, no? So I'll give you some of the examples now, no? Pfizer is collaborating with AstraZeneca that if in case there will be shortage of Pfizer vaccine, can they use second dose AstraZeneca? So they're going to do a study on that, no? AstraZeneca is collaborating also with the Bharat Institute of India. Of India, that if their vaccine will be of shortage, can they use another vaccine company, no? So ngayon tinitingnan nila yan. So hihintayin natin yung mga pag-aaral niyan kasi pag dumarating yan, sasabihin nila, yeah, if you receive Pfizer vaccine, based on our study, when we gave AstraZeneca vaccine, there were no bad antibody interference and the protection was maintained. Doon natin malalaman. So ngayon, wala talaga, we don't recommend mixing vaccines, no? Kasi walang pag-aaral pang nakikita.
Okay, I want to go back to this person who asked about her son not being allowed to get a vaccine in Singapore. Now, because I noticed, and tell me if I'm wrong, no? Certain vaccines are less allergenic than others. No, I think the Sinovac, the vaccines which are made from deactivated viruses may be less likely to cause severe allergies than the ones with like Moderna and Pfizer. Am I right or am I wrong?
Yes.
I'm correct. No, so perhaps this lady whose son was not allowed to receive a vaccine, perhaps the vaccines being offered were the ones where he may have been allergic to latex, a certain material, which are the materials needed to how do you say this, to what word was that, to stabilize those vaccines, diba? The polymers and everything. So if your son is allergic to those things, certain things, then he definitely cannot take those vaccines. So maybe we may be able to explore other vaccines. I don't know. I'm not sure. Jean, you can go to Jean.
The with the vaccine, no, ang crucial kasi sa mga bakuna, no, if you look at the ingredients of the vaccine, talagang pinopost nila yan lahat, no. These ingredients, aside from the vaccine itself, no, this will make the vaccine stable.
Yes.
Okay. But there are some of these ingredients na talagang mayroon kang allergic reaction to that, no? Like for example, itong Pfizer and Moderna, ang tinitingnan lang ngayon yung the polyethylene glycol, no? So
yes, polyethylene glycol.
Oh, 'di ba? May mga component ng mga latex na may polyethylene glycol kung allergic ka doon. So you're not you are not allowed to be given that vaccine kasi meron kang allergic reaction with that
Yes.
component.
Latex and even suppositories, di ba?
Yes,
Yeah,
meron
so you,
ganun.
I mean, you cannot take those kinds of vaccines. So maybe your son had allergies to specific ingredients of certain vaccines. So maybe you can explore other vaccines, no?
Yes, yes.
Okay, that's why. So that's my only answer. Now let's go to the immune system. There are some certain people here who have cancer, who are cancer survivors, who had colon cancer. Can they get the vaccine?
Yes.
Okay.
Okay. So
Okay.
the question then, the answer then is vaccine safe for them? Yes,
Mhm.
it's the vaccines are safe for them. Is the
Yeah.
vaccine effective also? Can it be effective against COVID when they will be given to immunocompromised? No. So that question is difficult to answer kasi ang nangyayari niyan doon sa clinical trial, wala kasing mga cancer patients on immunosuppressive na sinasama doon, no?
Mm-mm.
Normal yan, no? Kasi talagang ma-affected ang efficacy ng bakuna because we know that if you have cancer and you are on immunosuppressive drugs, the efficacy of the vaccine talagang mag-lower yan, no? But it's not zero, no? It's not zero. That's why in the current guideline recommendation, if you have cancer and on immunosuppressive drugs, okay, merong you have to consult with the oncologist kung ano yung mga immunosuppressive drugs na you have to stop before you will be given the COVID-19 vaccine because it can also affect how the vaccine will produce an antibody, okay? And then ang importante diyan na yes, you can receive this vaccine because kayo yung higher risk of getting COVID in more severe form. But at the same time, there are no data how effective. Kasi yung 70, 90, hindi yan applicable sa mga immunocompromised. But since these vaccines are able to produce an antibody, there's also a possibility that you'll still produce an antibody kasi hindi naman zero din yung immune response nyo, but it may be lower compared to the normal individual. But okay pa rin yun dahil you still have that amount of protection compared to no protection.
Okay, now so the cancer survivors, those on, first of all, if you have no longer on immunosuppressants, go, diba?
Yes,
Go.
agree.
If you are on immunosuppressants, it's not a absolute contraindication, but your response may be lower because you're immunocompromised. No? So, but the more you should have some protection, diba? Because you're high risk.
Yes,
Diba?
yes.
So it's better to have some protection than no protection. Okay. So let's go to a lot of fake news, Jean, no? Because the fake news involves death scares. You know, the other day when we had our first day of immunization, there were some nurses who fainted, not in PGH, but in some other hospital, 3 nurses. And the media was saying, hinimatay yung mga nurse pagkatapos ng bakuna. They did not continue the story. Hinimatay kasi ninervyos. Hindi sila hinimatay dahil sa bakuna. But you see how media can sort of create all this fear, no? So now, of course, because of all the media traveling so fast, social media, mainstream media, you get news. First question, what can you say about the blood clots after AstraZeneca in Europe, no? And why did Norway and Denmark halt their use of it in the meantime? Is this something to be worried about, or is just SOP?
Yeah, that's part of the SOP, no? Kasi they just want to be super cautious na if these are related to vaccine. No? Pero meron na silang statement kanina na based on their investigation, there is no causal, no? Tawag na causal relationship that the vaccine was the one who triggered the development of this stroke.
Clots.
Kasi
Strokes. Yeah.
kinumpare nila noon, ma'am, no, na like in a month time or 3 months, ang incidence ng stroke sa population is like 3%, no? And then, tinitingnan nila with the vaccine, wala naman daw pagbabago na nag-spike na because nabakunahan, tumaas ang stroke na nangyayari, no? So, it's still very low at that, ang low ang incidence ng stroke nila. So, that's one reason na sabi nila na there is no direct relationship of this vaccine being able to induce that phenomena or stroke.
Okay. Now, yeah, it doesn't have parang there's no causal relationship, no?
Yeah.
Just FYI, when you're doing vaccine trials, and even if you have, for example, now there's a death, it's because of natamaan ng bus, okay? Natamaan,
Yeah.
but you still have to report it as a death, although it's not related to the
It's the
vaccine.
vaccine.
So sometimes if you don't know how to read the the report, you might think it is because of it. Then it turns out, ay, hindi pala, but it still has to be reported. Okay? So that's why. Now, about ivermectin, it's all over the place. Ivermectin, I want to get your reply as a safeguard and prophylaxis while waiting for vaccines. Can you say anything about
Yeah.
ivermectin?
So three important institutions, no, I would say that we follow in terms of how they uh, make guidelines. Kasi ito yun silang talagang the apex of the highest institutions in terms of guidelines, no. One is the IDSA, the Infectious Disease Society of America. Second is the NHS UK. And then the third is WHO. All of these three did not give any recommendation with ivermectin. So in short, the evidence is really weak. Meron na silang mga nilalabas na mga statement that we don't recommend ivermectin, whether it's prophylaxis or treatment. So I think that's the short end answer of that question.
The maker of ivermectin is Merck, right? Merck, correct? And they came out with a statement that they do not recommend it. So Merck, the company itself that makes the medicine, you would think that if they could make a lot of money, diba? But they themselves came out and said no, and they're not making any vaccine.
Yeah.
So I think in fact we can share the link with you later on of the Merck statement, no? Because that's very telling. If the maker itself of the medicine says no, please do not use it that way, I would tend to believe them because they could make money, diba? Okay. So now there's another one. Pfizer. Okay. What about somebody wants you to explain the difference between the delivery or the platform of Sinovac, which is a dead or deactivated virus, unable to replicate, versus Novavax, an activated Novavax, which is actually a vector, correct? No, it's like a shell of adenovirus, correct, with a genetic material inside. Now, and which one would you give to a person who is risk averse, the one who's really afraid? Which you think is the safer one? I know it's hard to commit all of that, and there's no perfect vaccine. But somebody who's so takot na takot, what would you give them? Novavax or
Ganito,
Sinovac?
ang Novavax, no, is a protein subunit siya, no. Now, this Novavax, meron siyang pinapatent na component na vaccine sa kanya, yung tinatawag namin na M1 adjuvant, no. The M1 adjuvant is the one that really stimulates the immune cells to produce the antibody. But the problema dito sa mga adjuvant, it can also induce hyper sensitivity reaction, no. So I mean, each of this vaccine may mga component talaga na maski sabihin natin na the safest, but it can still cause this mga allergic reaction. Kaya doon sa mga trial, talagang gusto nating himayin yon, titingnan natin ilan ang nag-develop ng allergic reaction. Out of this, what is the grade of the allergic reaction? Is it severe or is it just a minor, no? Kasi doon, they can explain to this in the trial na this is because of one of our excipients, no? Yung excipients, yun yung component ng bakuna that can cause. So, I think ang tingin ko dito, Novavax, wala pa kasi silang nilalabas na safety sa phase 3, but they have their safety doon sa phase 2. And in fact, the reaction is also very low in terms of allergic reaction. Parang Sinovac din ang ano niya, ang profile niya.
Yeah, Professor. So I think I know Sinovac because it's I was being interviewed in the radio. Pwede ba nating sabihin, doktora, na Sinovac ay natural, organic, at yung mga iba ay synthetic? Oo, totoo naman. Organic,
Yes.
kasi it's the virus. No? So if you think of it that way, it's safe as far as less allergenic, no? And Novavax is similar, I think, in the capacity to create allergies. Is that correct?
Yeah.
Okay. So I think either or. Pwede, if you're
Yes.
risk averse, no? Either or. Okay. Now, there was a question. Pfizer and Moderna have to be stored at -70 and -20 degrees respectively. If this is not followed, will the efficacy be lost if you don't store it properly?
Yeah, kaya minsan nagbibiruan kami, no, mga sa panel na itong Pfizer, pangmayaman lang to na bansa kasi you need a -70. Pagdalhin mo yan sa Pilipinas, napaka-sensitive ng -70 mo eh. So kaya doon kami, nung we gave the panel, when we gave the grade in terms of yung sa storage niya, pinakamababa siya dahil sabi namin, paano mo yan dalhin sa Mindanao? Dalhin mo yan sa Palawan or mga area na idadalhin sa aeroplano, no? And then it will take madelayed ang airplane, madelayed sa traffic, ano, and then the minus 70 will really be affected by that
Yeah.
particular factors, no? Kaya minsan nagsasabi kami, it's better to get the 2 to 8 even if you had the minus 70 na ano, higher efficacy, because at the long end naman, the more stable is the 2 to 8 compared to the minus 70.
Yes. So every vaccine has its plus and minus points, no? For a developing country, an island nation, it's more practical to have the vaccines that can be stored at refrigeration temperature from 2 to 8 degrees, like Sinovac, AstraZeneca, Novavax, diba? They're
Yes, yes.
refrigerator. Yung Moderna is minus 20, which is our freezer temperature, which
Yes.
is also easier, the regular freezer. Now, question, has Moderna applied for an EUA? How come, there are so many companies who have already applied to buy Moderna from the Enrique Razon and others. No, and yet we haven't heard that there's an EUA yet from Moderna. What's up with Moderna?
I don't have any idea then, no, kung nag-apply na ba sila, but we already gave our evaluations sa Moderna.
You did?
Okay naman
but
siya. Kaya lang, wala
okay naman siya. You gave your evaluation, but they have not applied yet for an EUA.
Yes,
as far
yes.
as,
Wala.
yeah. So I don't know why. No. Now, can seniors with hypertension and heart problems take the vaccine? If yes, which one is the safest? Another one, similarly, you're taking Plaquenil for lupus, no? Hydroxychloroquine, and in remission, can you take the vaccine? These are the questions.
Yes,
Specific questions.
unahin natin yung hypertension and heart failure, no? So, ang sabi
Yes.
namin diyan, pag meron kang hypertension, before you'll be getting the vaccine, dapat stable ang hypertension mo. Why? Because if you notice sa mga bakuna ngayon na binibigay, especially doktora, no? I think you've heard na ang pinaka most common na nakita sa Philippines when they were giving the Sinovac, tumaas ang blood pressure.
Yes,
Tumaas ang blood
hypertension.
pressure.
Totoo yun, nakita ko rin yun.
Oo, so siguro yung sinabi mo kanina, ma'am, na parang natakot siguro.
Nanervyos.
Nanervyos. So siguraduhin nyo lang, maintain yung blood pressure nyo bago kayo magpabakuna. Baka tataas yan, no? That also goes with mga heart failure, kung stable yung heart failure nyo. While for those taking Plaquenil or hydroxychloroquine, no, these are not contraindications for receiving the vaccine. No? So you can be given the vaccine.
Okay. And what about those taking Plaquenil? No? Okay naman, di ba?
Okay na, yes.
In remission, yeah. I think we can state later, what are the absolute contraindications if you have been allergic to a component of the vaccine?
Yes.
That's an absolute contraindication.
Absolute
That's the only one I know.
Yes.
A known component. Absolute. The rest, there's caution. You have
Yes.
to just tell your doctor. No? If you've been severe allergies to vaccines in the past, and things like that. No? Okay. Which is the preferred vaccine for someone who had severe COVID already, and how soon can they be vaccinated? Recovered from severe COVID, how soon can they be vaccinated, and which do you think is the best vaccine for them?
Okay. So sa mga nagka-COVID na, no, since they already have developed an antibody, that's their advantage, no, kasi meron na silang antibody. So the COVID vaccine is not contraindicated for them. They still need a COVID vaccine. That's one, because they can still be reinfected after 3 to 6 months of the antibody, yung convalescent antibody nila. Talagang mag-wane off yan, and then you can be reinfected. So the current recommendation is, if you are in a country where vaccine is abundant, okay, you can get the vaccine anytime, okay, if you want, no? But in a country where allocation is really scarce, then you have to prioritize those that doesn't have any antibody yet. So sila yung unahin mo, and then you can wait for 90 days before you'll be given the vaccine.
Yeah, so at least 3 months, after 3 months, 90 days.
Yes.
That's the rule now, even in the hospitals. Okay, so so you can wait a while. Huh? Now, somebody here is very doubtful of Sinovac. So there's a question: is the data for Sinovac really all out there to see? We can overcome the distrust if professionals think that their data and reporting are really accurate and all out for everyone to see. So you are a member of the vaccine expert panel, no? What made you confident enough to say it's okay, and you received it as well? You got the Sinovac. I got the Sinovac. What made us confident to get it? So
One is
maybe
that
that's also
the clinical trials were conducted not in China. So one is in
Mm.
Indonesia, one is in
Turkey,
Brazil, and then one in
Turkey,
Turkey.
Turkey.
Yung sa
Yes.
Turkey, yung primary investigator doon, kilala kong infectious disease yun eh. So, so talagang I had full trust in him, no, when they conducted
Mm-mm.
the trial there. So, I
Yes.
mean, we might have distrust, but we also have some requirements for them to submit para lang to satisfy our mga clarifications about their data. So they were there naman, no?
Yeah.
Nagbigay din sila ng mga sagot nila, and I think that is enough to really warrant the approval siguro ng time na when they were applying for an FDA EUA.
You know, I know what I'm going to say might be a little bold, no? But in medicine, there's also a lot of politics, no? Even to get papers published, there's a lot of politics. And Jean, I have the advantage that I talk to a lot of vaccine experts as well. And Jean, they know each other internationally, and you know who are the reputable ones and who are the not reputable researchers. No? And in Turkey, it seems the process or their protocol, the methodology was correct. Okay, they checked in their sample population. They checked who already got the infection, who had antibodies, and if anybody had antibodies, they were not allowed to join
Yeah.
the trial. That way, the placebo was given to people with no protection, and then the vaccine was given to people with no protection. Therefore, you could really do a good comparison. Unfortunately, in Brazil, the problem with Sinovac, they did not have or they don't have uniform protocols in their trials, and so iba-iba. In Brazil, unfortunately, they did not check first for antibodies. Okay, so what happened was that some people who got the placebo had antibodies na pala. I mean, I'm telling you this, I'm being very candid. That's why I tend to believe the Turkey study more. Okay? And the Turkey study shows that it has a good efficacy, higher efficacy,
Yeah,
diba?
higher siya.
73 instead of 50, diba?
Yes.
Therefore, all I'm saying is that there are things the doctors know that they cannot really say so much in the general public. And people keep saying, we're waiting for the publish, we're waiting for the publish. I've had papers from Asian doctors that couldn't get published for a long time, yeah, because of politics. So I know it happens. But all I'm saying is that I had it, Jean Solante had it. We're not saying this because we're pro-China. No, there's no politics here. I'm as upset as anybody else about all these geopolitical problems. No, I'm very upset. But it's the vaccine that's there. Yeah? And it's safe and efficacious. So we took it and to show everybody that, hey, we're okay. No? And we're happy we took it. So, yun lang. No? Anyway, okay. So there. No? Turkey and Brazil, somebody said. Okay. There's so much xenophobia around because of local media and social media. That's also correct. No? If one receives Sinovac, does one still need to have an RT-PCR swab test upon riding an airplane or travel, considering that Sinovac vaccine has only, again, 50% efficacy rate and still be a possible carrier? Those are the questions. No? Another thing is, but somebody asked me before, if you are going to the United States, for example, and you took Sinovac or Sinopharm, will that prevent you from going to the US because the vaccine is not being used in the US or
Yes.
Europe? Those are the questions which were asked of me. So what is the answer there? No?
Well, ang requirement pa naman ngayon, hindi pa naman sila naghihingi ng ng yung tinatawag na vaccine passport, no? Wala.
Wala ganon, no?
Wala. So,
and then wala pa. So it's whether even if you're vaccinated, completed, there's no assurance that you cannot infect others. That's why you still have to wear a mask. But if you get the vaccine, you will not get sick. If you get the virus, rather, in all likelihood, you will not get sick. No? But CDC, correct me if I'm wrong, has already allowed people who are fully vaccinated to get together without masks, no, and to visit also some people of a limited, even those non-vaccinated. There's some rules, no, that they're already giving.
Because in the US, I think they have already vaccinated almost one third of their population, no? In a span of three months pa lang, 3 months. Ang bilis nila.
Yeah. So, yun. So, I don't know if there are other questions I forgot to ask. No. There. Oh, here. I'm allergic to some antibiotics, to nonsteroidal anti-inflammatories. By experiencing develop delayed reaction, and I experienced delayed reaction sometimes an hour or so later. What would you suggest I should do to prepare for such a possibility after receiving a vaccine? No.
So these are the individual that they will be monitored for 30 minutes after receiving the vaccine.
Yes, more than 30 minutes, an hour. I guess you should tell your doctor, no, that you have delayed reactions
Yeah.
to the vaccine, so you can be monitored longer, no. Shall I have my 85? Okay, this is another thing about seniors, huh? There's a question here. Shall I have my 85-year-old grandmother have her Sinovac now or wait for other brand options? Is time really of the essence? 85-year-old grandmother. Should she get Sinovac or wait?
Yeah, nandun siya sa senior citizens, nandun siya sa phase 2 eh. So ibig sabihin,
Yes,
higher
yeah.
risk siya, no? So
Kaya
if it's
lang,
an opportunity, get the vaccine.
yeah,
Oh.
kahit Sinovac. Kasi ang
Yes.
problema, Jean, the people are confused because the FDA said that it's only for up to 59 years old, no? Although a lot of seniors among the physicians chose to get Sinovac, di ba? First was extended to 65, and then some, I know, 71, they were getting it, no? How safe is it for a 85-year-old woman who doesn't naman go out, is not a doctor, who's not exposed to patients, a regular housewife or regular lola who's 85 years old?
Pero ang nakikita natin ngayon sa yung household transmission, ang na-admit sa mga hospital, ang mga matatanda eh.
Yes. So would you suggest that they
Yes.
get it? For example, it's the one available. But will our government allow it? Because some hospitals are not allowing it for above 60, which is for me a little crazy.
Yeah.
Huh?
In other countries, no, I think the Philippines is only the only country that limit the indication for the Sinovac. But for other countries who had been rolling out Sinovac, it's 18 years old and above.
And above. Yeah, kaya nga. So maybe you can recommend that, Jean. The VEP can recommend it to the FDA. As balikbayans who had the vaccine are asking why they're still subjected to quarantine when they land in Manila. I don't know.
Yeah,
Those balikbayans na vaccinate na sila, pina-quarantine pa raw sila.
ano yan eh, policy kasi ng country yan, no? So wala pa naman tayong ganung policy na for fully vaccinated abroad. Ito yung. So maybe we'll have to wait. Baka next few weeks from now, meron na tayong ganung policy.
Okay. How long is the efficacy of the vaccine? I don't think, but you can answer. I don't think there's a
Okay,
answer for that yet.
doon sa mga nakita namin, no? Kasi may mga real world experience na ngayon eh, no? Like some of these vaccines claim that after 6 months they still maintain the protection. Okay, so pinakamatagal is the 6 months because of the Pfizer, Moderna, and that of Astra, no? So pang 6 months na nila ngayong last month. So they already have data on that mga sa mga press releases nila na they were able to maintain the efficacy even after 6 months from receiving the vaccines.
Yeah. So we will only know the answer is there as time goes by. We will be monitoring the people after vaccination, and that's the only time we will be able to have the data because this is all very new, no? Okay. How soon can you take the COVID vaccine after you've had the pneumococcal vaccine?
Yeah, the interval of 2 weeks. So any vaccine like pneumococcal or flu vaccine.
Okay.
So at least you have to have the 2 weeks before you'll get your COVID vaccine.
Okay, at least 2 weeks, no? Can somebody buy their own EpiPen and bring it home with them? Of course. You can, if you have EpiPens at home and you have you're developing an allergy, of course you can give yourself an injection, diba? If you're used to that.
Yeah.
I mean, there's nothing to stop you. Now, currently, international travelers to the USA still need to go on quarantine. Restrictions lifted for domestic travelers only by April 1. That's a question. I think it's an answer, no? Do not have hypertension. I had AstraZeneca shot and my BP went up to 220 over 150. Is it safe to take second dose if I consult my cardiologist and neurologist? Tumaas na yung BP niya after his first dose of AstraZeneca. It went up to 220 over 150. Yeah.
Pwede pa rin.
It's also possible, could it be, maybe you should have a checkup now with your cardiologist. perhaps you have hypertension, you
Yeah.
don't know
Oh.
about it.
Mm.
Pwede rin, ha? And could have been natatakot ka rin, no? Alam mo, ang daming tumaas ang BP. Some tumaas ang BP even prior to getting the vaccine. You know?
Yeah.
Because I guess they were a little nervous.
First time nila. At saka, yung mga napalitan
Especially the
sa
guys, he
social
was under
media.
65. He was the first one to get the vaccine. Prior to the vaccine, mataas na yung BP niya. No? So it could be also anxiety. No? I cannot see people raising their hands. So after vaccine this year, we will need to get another one. No, we don't know that yet. No,
Yeah.
we don't know how long the immunity lasts. Okay. Okay. What scares me the most? This is from somebody. Yeah, is that about the vaccines, especially mRNA. A lot of people are afraid of mRNA, now Moderna and Pfizer. Is that there are not enough data and studies on the long-term effects. Thalidomide and Dengvaxia were approved, but the side effects only came out after. May I have your opinion on this, please, regarding the possible side effects? No? Okay.
The possibility of a long-term side effect with these vaccines is really remote, no? Because these are new technologies, and in fact, when they look at the phase 1, the phase 2, there are really no indications that there will be a long-term effect of these platforms, no? I would just like to correct, no, yung Dengvaxia naman, wala namang problema yun eh. Ang sinabi lang naman sa Dengvaxia na based the studies nila, yung in areas na hindi pa na-expose, mataas ang risk ng maging severe, no? But that's the only data na talagang very transparent din naman sila, no? And they didn't even say na mamamatay ka because of that, no? So, balikan natin tong COVID-19, no? Yung mga haka-haka nila na may mga thalidomide effect or something like that. I don't think, no, we have a very good technology now in making these vaccines very safe and very effective, no? So I don't see those mga side effect na nakakatakot tingnan.
Yeah, and please be assured that the mRNA does not enter the nucleus of our cells.
Yeah.
No? They will not modify our own DNA. They only stay in the cytoplasm where the mRNA is, and then your cell will produce the spike protein, then it will self-destruct afterwards. So it's programmed. It's not going to change your genetic material. No? Because before they were saying it will enter the nucleus, mix with your DNA, change you into a mutant. No? It doesn't do that. No?
Actually, yung mechanism sa mRNA, napaka-unstable ng mRNA. That's why you need a nanoparticle, the lipid nanoparticle, para balutin siya so that once you inject that, makapunta siya doon sa immune cells natin. Once it's inside the immune cells, mag-disintegrate yung lipid nanoparticle. And that's the one causing the reaction. Kaya na-disintegrate na siya kasi nandun yung polyethylene glycol. And then once that mRNA component is inside, wala na siya. Kainin na siya ng ng cells, tapos it produce an antibody. So it's really something na hindi siya ganun ka-significant.
Okay. Maritas
Dr. Mingy,
Pinedas
I'm
raising her hand, but
okay.
yeah,
I was
Marites
going to
Pineda.
tell.
Yeah. Go ahead. Yes, Marites Pineda is raising her hand. Can you unmute her? I cannot unmute her. Wala. Anyway. Hello.
Marie, can we
yes,
unmute her, please?
Yes, I'm in.
Yeah. I cannot hear you. Some people are saying that let's make masyadong highfalutin minsan. From Attorney Noel to everyone,
Yes.
she has to unmute herself. You have to unmute herself, Marites. I cannot unmute you. If you want to ask a question, you don't want to type it down na lang. Okay, so 6 new messages. I feel well informed and have now peace of mind. That's nice. Thank you very much. This is from Arnold Dizon. I feel well informed and now have peace of mind with the vaccines. Thank you very much to Dr. Salante and to me. Thank you. Our pleasure. I cannot unmute Marites no, Rose. No?
You can unmute yourself.
Okay.
Yeah, you can unmute yourself, Marites, if you want to ask a question. If you don't want to type it down, no. Are there any other questions I did not get to answer or get to read out? No? You can type it again. Uh, there were a lot of questions. I think I was able to ask all the questions. They're basically about allergies also. No? Cancer. Okay. How soon? Uh, not enough data. Colon cancer. About another brand. Okay, I think I asked all the questions that were asked. No? Any more questions before we? Is a vaccine safe for women planning to have a baby?
Yeah.
Jean?
Yeah.
Yeah.
So it's not contraindicated, no?
Mm.
Anyway, planning pa naman eh, hindi pa naman buntis.
Pregnant? I think kung pregnant,
Kung
pwede ba?
ang advice natin sa pregnant, as much as possible, kung frontline healthcare worker ka, no? Nandun ka sa priority population. But if you're not in the priority population, then nandito ka lang sa ano, you have to wait for at least mga 3 months or the first trimester, second or third, medyo safe na yung bakuna doon.
Okay. Somebody may have missed the discussion, no? Because he asked about, is it safe to take two kinds of vaccines? I think you answered that, no? That they're still studying it. Okay. And then, so that one, no? Why is there no vaccine for children, and will there ever be one for them?
Yeah, there is Pfizer. I think Pfizer is now have an ongoing trial for children, 12 to 16 years old, but no, so far none for the 12 years old and below.
Okay. So, but there are studies already, no? So it's 12 now. Before kasi 18 eh. What about 13 to 18 may studies na? 13 years old.
Meron ongoing ngayon, 13 to 18 and 13 to 12 to 16 and 12 to 18.
Okay. Status of the Russian vaccine, would it be advisable also for us Asians? I think yes. Now the Sputnik, you already answered that. It seems to be good.
Maganda naman.
Maganda. Oo. So what antibody level is a good level? There's a question because okay, how do you now follow up people who are vaccinated? How do you know that the vaccine worked? Because we are being monitored, diba, for our antibodies. So can you explain a little bit? Is there a level that you have to reach to say okay ka or not really? Basta reactive ka, you know?
Okay, at the moment, no, we don't have a test that will really determine how good the level of your antibody that is elicited by vaccine, no. Most of the antibody level na ginagawa doon sa clinical trial are in the research for research lang yon, no, yung neutralization at saka binding antibodies, no. But eventually there will be companies later on that will embark on that na medyo malaki din ang value on that, no, kasi halimbawa mag-develop ka ng antibody or what antibody is really enough to say that you are protected. In the clinical trial, there is a threshold for an antibody, no, yung seroconversion. Ano ibig sabihin, from zero antibody that you produce 2 or 4 titers from that zero. Now, in the rollout, there is no recommendation that after vaccination, you have to be monitored for an antibody, okay? Because we don't have a test that will determine kung yung antibody na muna produce is adequate or not adequate. So sa ngayon, hindi pa natin alam what antibody level is good and bad or not good, something like that.
Yeah, I think you get the picture now. There's so much, we don't know how long will the immunity last. We're studying that. At least we know at least 6 months for certain vaccines. Meron na, no? So we'll get to know more and more. Can fully immunized people enjoy life with less restrictions and precautions, or should they still practice the same protocols if fully immunized?
Yeah.
No?
The more important way there is fully immunized and majority of us. So, hindi lang yung ikaw yung fully immunized, pero ang kasama mo doon sa bahay, walang bakuna. Dangerous pa rin yan, no? So, fully immunized and full population being immunized. So,
or at least herd immunity, 60 to 70%. No?
More people being immunized. So, pwede na yun pag nakita natin. And the only way to know that is when we look at the cases, no? like ngayon sa US, nakita na nila yung meron ng dent in terms of effect ng bakuna, sabi nila, no? Because the cases are going down. Okay, which is really something encouraging also because the more people that will be vaccinated, doon natin mafe-feel kung bumababa na yung kaso because we have immunity to the transmission.
Yeah. Like if you've been fully vaccinated, no? Like kami ha, okay. My husband has so many friends who are doctors and we're getting vaccinated one by one. So if all of us are vaccinated fully, we can have a gathering
Yeah.
because we will not make each other sick. Okay,
Yes.
okay na kami. We can have a party, we can be together. Now, however, if I have been fully vaccinated and I go somewhere to a house with a person who hasn't been vaccinated, I might still be able to transmit the disease to that person. I will not get sick, but if I have it in my nose, for example, I might still transmit it. So you still have to be careful, to be mindful of others who have not been vaccinated. But you yourself, you are more or less, confident, no? But you have to think of others also. So ganun ang situation. I think the other questions I take methotrexate because of rheumatoid arthritis, plaquenil. Yes, you can still have the vaccine, no? I don't think there's any vaccine that's contraindicated for rheumatoid arthritis and plaquenil, no? Wala pa naman.
Yeah, wala.
So,
Even autoimmune, no? Autoimmune, yun yung common questions. If I have autoimmune disease, can I still receive the vaccine or are there
yes.
vaccines?
Yeah,
Yes.
we answered most of these questions already. Cancer patients, okay naman, we answered this already. I'm taking Glivec for a year already. Can I be vaccinated? Glivec, what's the generic of Glivec again? I don't know this is generic. Can you give me the generic? AstraZeneca vaccine, okay for me. As we said earlier, hanapin ko yung the only absolute contraindication talaga is allergy to a component of a vaccine. Even allergies and autoimmune is not. No? Yes, this presentation is available online. It's going to be in the San Antonio. Glivec. Imatinib.
So these are immunomodulators, no? So
Again, immunomodulators.
That can also affect the antibodies, no? So there are guidelines on that. Na you need to consult with your doctor if they can discontinue that, no? Dalawa lang ang option yan. You will be given the vaccine, but your chance of getting or developing antibody will be very low. Or in order to maximize the efficacy of the vaccine, it's either you will hold the drug and give the vaccine and then resume it after you were able to get the 2 doses of the vaccine.
Okay, so there. No? I think we've already answered the questions here. No? If you have any more questions that we didn't answer, no? Then you can email it to Rose and she can direct it to us. But I think we answered basically the questions that were asked tonight. No? Rose, you have any, I think, Jean, you have any parting words?
Yeah, so ang masasabi ko lang, ma'am, no, na once vaccines are being offered to the population aside from us, no, sa inyo, no, sa general population, you have to be open to that, no, because I think it's our way of really ending this pandemic, and I believe that our hesitations, there's no way that we will be hesitating vaccines, because if you are hesitant because of some doubts of its efficacy and safety, for one, if it's approved by FDA, if it's approved by the government, then that would be proof enough that it has gone what we call tedious and rigorous evaluation.
Okay, so I share the sentiments of Jean. That's why do you think we offered to be the first vaccinees? No, I was one of the first 5. No, and because we really believe that this is the only way out. No, and it becomes a duty not only for the doctors. It's our duty as citizens, no, to be vaccinated. No? And if it's there, the best vaccine is the vaccine you have on hand. No? Don't keep waiting for a better vaccine. It might not come. There is a very, very big shortage of vaccines in the world. So it is a reality. So let's, if offered, I know some barangays or some LGUs already listing and the seniors especially will be next in line, please do it, no? And just coordinate with your doctors. Don't be afraid. Nauna na kami and we're still okay. So we're okay.
Glad
We're
that
not
you're still okay.
what?
We're very glad that you're
Yeah.
still okay.
We're fine, and I think we're the living proof that we're fine, and we're not becoming mutants, so we're not talking Chinese.
We're excited for the second dose.
Yeah, we're excited for the second dose,
After
and
1 month.
kasi I got mine March 1, so I'm gonna get mine March 29.
Hmm.
So yun, so I will let you know, Rose, how I am after the second dose, no? Yeah.
Thank you so much, Dr. Jean and Dr. Mingita. You know, most of the time we're driven by our fears. And also, if we don't know much about something new, we're very afraid to take it. No, but thank you, because you took time out to answer all our questions, and we
Yeah.
really appreciate it. May I call on Teng, please? Teng.
Hi. Good evening, everyone. Thank you for staying on, even though it's late already. And thank you for answering all the questions, Drs. Solante and Dr. Mingita. Thank you for sharing with us your knowledge, experience, and expert advice on vaccines. I'm sure it answered many questions and confusions that we all have on vaccinations because of the different brands, virus strains that we have now, and efficacy rates. We have high hopes on the endpoint of vaccines to prevent severe COVID cases and risk of death, and to prevent the risk of transmission. Let us keep praying that the best and most appropriate, or whatever is available, vaccine um, for us will be administered soon. Thank you, Dr. Mingita, for moderating the discussion, for your sharing your experience that you have a lot of allergies and still get vaccinated, for having the trust and sharing with us your confidence. This talk is live right now on Facebook and YouTube, so you can play it again and review, and maybe we can pick some more answers to our questions and doubts. We would like to invite everyone. So this will be a regular session in our parish at 8 p.m. on every Friday. We call it Mini Streams. It's a new project. It's a new show. So same time, same channel. But next week, it's going to be EMHC who's going to spearhead the talk. It's going to be about partaking the living bread. It's a brief recollection on the sacrament of the Eucharist with Father Paulo Pirlo. We hope to see you again soon. Hopefully, let's try to meet again, and when we all get vaccinated. Thank you to everyone who listened today. Have a blessed evening. Stay safe and well.
Thank you.
Thank
Good
you,
night.
Bye.
Good
Bye.
night,
Thank you.
everyone.
Thank you.
Thanks,
Bye,
Bye.
ma'am. Bye,
Thank you,
ma'am.
everyone.
Thank you. Thank you for
Thank you.
inviting us. Our pleasure.
And thank you also for informing us.
Okay. Stay safe, everyone, also. Huh? Okay. Bye-bye.
Stay safe. Bye. Good night. Thank you.
Good night. Oh, Rose.
Yes. Yes.
Rose.
Doctor,
I will send you the link to the Merck statement. Rose,
Oh.
can you hear me? Can you
yes, I
hear
can
me?
hear you.